Hi everyone, my name is Nicole Morrill and I am doing my presentation on person-centered theory. So to begin, I'm just going to kind of touch base on the history of the person-centered theory, also known as person-centered approach. This theory was developed by Carl Rogers, and it's the assumption that humans move towards wholeness, unity, self-actualization, and that they have the ability to navigate in their own direction with minimal help from the facilitator. Looking at Rogers' work, the common theme that I noticed was trust. Trust in the client's ability to move forward if the growing potential is available. Trust in the facilitator and the group members, as well as trust within the group members of the session. So beginning research of the approach showed that the client was the person in charge. The therapist was more of a person who was meant to guide and not lead. Later, this approach kind of shifted, and research showed that the attitude, behavior, and relationship from the leader was one of the keys, was one of the major keys to having a successful therapeutic session. So some key concepts of this approach. The first one is that there's a basic trust in human beings' tendency to realize their full potential. This approach is based on a deep sense of trust in the group's ability to develop its own potential and moving in a constructive direction. There are 3 therapeutic attitudes that the facilitator should have. And the first one is congruence, also known as genuineness. And this is, genuineness is pretty much being able to be involved in the group as a person, and they should be able to express eternally genuine thoughts, experiences, communication. The second one is acceptance or unconditional positive regard. So when a leader displays an unconditional positive regard, they are accepting, they have an accepting attitude toward their clients, and therapeutic change is more likely to happen. Therapists should communicate in a respectful, caring, positive attitude that affirms the client's sense of self-worth. The last therapeutic attitude that the leader should have is empathy. An empathetic understanding of the member's internal and subjective frame of reference. This is one of the most potent factors in bringing to the session about learning and self-directive change. Another key concept also allows clients to reconnect with themselves through therapeutic conditions. One of the main concepts is that this approach views humans as a unique entity. We are distinctive, we are inimitable, we are inexchangeable, we are a unique set of creatures. So just some important terms and definitions. The first one is person-centered therapeutics, and this is a combination of interpersonal union and humanistic discussion to orchestrate lifestyle change. And these lifestyle changes can be promoting health, preventing illnesses, healing illnesses, and so forth. The next one, as I mentioned in the last slide, unconditional positive regard. It can also be known as acceptance, and this is just respecting and accepting members of the group. We should accept them, care for the group members, and we should do this through a positive, appropriate attitude. The second one is empathy. This is appropriately understanding and relating to members of the group. The next one is openness to experience, and this is the ability to be open to new experiences, new concepts, and new beliefs. And lastly, the last term that I would like to go over is internal locus of evaluation, and this is the ability to listen, respect, to appreciate responses from the other members in the group, but not to become overly concerned with them. So the role of the group leader, based on some of the readings I was doing, the main role is to produce an accepting and therapeutic environment for group members. To understand this is a way of being rather than a way of doing. The person-centered approach emphasizes the personal qualities of the group leader rather than techniques of learning. To establish a therapeutic climate, the role of the group leader allows group members to interact in a raw, honest way. Group leaders should always have a positive attitude, show empathy, and be patient. A lot of successful, appropriate group leaders with this approach operate from their own experiences, which is how the here and now is incorporated. They avoid judgment, provide active listening without pushing for a deeper meaning through operating in terms of their own experiences. Multicultural and diversity. So this approach has been applied to bringing people together to find a common ground. Different cultures talk and they find a commonality that unites them. So this person-centered approach has been applied to bringing people of diverse cultures together for the purpose of developing a mutual understanding. One of Rogers' big hopes was that people from different cultures would be able to listen to one another, find the common ground that unites them. There should also be no assumption with members. Each member is unique. So some strengths and weaknesses of this approach. So some strengths include responsibility, empathetic listening, deeper understanding from the clients, because the clients come from an eternal source. Some research has shown that this is a great initial stage for any type of group because of the closeness, the respectfulness, the communication of the approach with this group. The main, one of the main strengths is emphasis on listening and understanding the client's world from their internal frame of reference. Empathy is a concrete of this approach and is a necessary foundation upon which any theory rests. Another strength that was mentioned is the core values and principles upon which the person-centered approach rests. This approach emphasizes each person's ability to find the answers for his or her own problems. This goes back to the leader being more of a guide rather than a leader, and guiding the members to find that sense and to find their own answers to their own problems. One of the big strengths of this is the reward that therapists and leaders see as people take charge of their own lives. Some weaknesses or limitations of this approach includes little structure, limited practice settings, and the leader more of a member, less expert, more companion. So little structure, with this being a client-focused, person-focused approach, it is based on the client. The client moves at their own pace. They have their own exploration, and that can provide little structure. Certain settings such as community mental health clinics or some kind of outpatient treatments, they may need a more structured group experience, especially something in a short-term facility. So that's something to keep in mind. So just to go over a little bit of Joe's story. He is a 24-year-old male that was referred from another therapist. And it say that he has anxiety with little progress over 3 months of therapy. That's what was stated in his chart. Joe has feelings of unsuccessfulness and negativity around treatment. It is said that when he first enters the session, he doesn't make eye contact, he sits down. It shows that there's little group involvement upon arrival, little interaction that he has with the other members starting off, which is concerning to say at least. It doesn't seem like he comes in open-minded with a lot of positivity to this new group environment. So with this approach, there is less emphasis on technique and more on client's perception and feelings. It does, in the story, does show that the leader attempted to include participation, but Joe was disrespectful and he had disregarded. He was very negative. He didn't seem to want to actively listen to the other members. He interrupted them. When the leader tried to find the similarities with another member, Joe was like, I tried that, it's stupid, just complete negativity, he was not very open to new environment, new beliefs, new anything that could possibly benefit him. The group dynamic, from what I understood, Joe was the new person during this session. It seemed like the group dynamic was pretty positive before Joe. There was enough therapeutic relationship and a positive therapeutic relationship with that, that the members were comfortable sharing, comfortable opening up. When Joe came in and started discussing and interrupting and being negative, there were other members that were not happy with that. So I feel that the group dynamic and the therapeutic relationship between all the group members as well as the leader decreased significantly when Joe entered the session. So I would be interested in the group process observation, and this is pretty much placing responsibility on the direction of the members. There was a lot of tension with the group members when Joe started talking and cussing and being negative, that I would like to observe the group process and allow the members to communicate and express their feelings through this. Another thing that I would also want to do is work with Joe in gaining a therapeutic relationship. I would focus on gaining a therapist client relationship at this point, and then maybe work the way into a relationship with the other members. I noticed a lack of openness to experience and internal locus of evaluation. So he was not open to hearing new ideas. He was not open to discussing. He was very negative, very set forth, saying that he knew this wouldn't work. One thing that I would be interested in trying, I feel like it could possibly have a realization, is expressive art. I would encourage individuals to discover a personal shadow, and this is pretty much expressing their own meanings and feelings through this. We could find the group shadow, which is anger, frustration, rebellion, and I think that this could potentially be appropriate for this because of the negativity and the frustration and the continual negative vibe from Joe. So for the addictions technique, I went more broad on this just because of the flexibility with this approach, or theory. So the person-centered approach, there's language, communication, respect, reflection of feelings, because the techniques are so flexible, and it's based on the facilitator, the individual, that there are many ways to use this approach as an effective way for addictions. I was researching, and a lot of it was, communicating on why the individual decided to come to therapy to work towards the triggers on their addictions. The positive language, the appropriate language, the respect, the reflection of feelings. This all wraps around why the person began to drink or began to do drugs, and then it goes down to the deeper meaning of the triggers and why, how to stop, and that's all wrapped into the language, communication, respect, reflection of feelings. And these are my references. Thanks so much for listening. I really appreciate everything, and I cannot wait to hear feedback from you guys. Thanks so much.